as we continue to go forward and as I look at the future, because I will be part of the Medicare population next year, we need to come up with answers because as we get older, we need more. And as an economist, I also recognize, since we talked about the economy earlier today, that we have, as the people that control the majority of the wealth in the world, okay, in the United States, in the Western Europe, okay, we are the 1%, okay, get over it, we are. And we are also the ones that are gonna pay the bills. And so as we look at that, we have to recognize that as the baby boom hits its peak spending years, that is the economic challenge of our generation. And the only way that, and I have these conversations in Congress on a regular basis, the only way we will be able to address what is coming at us relative to cost is to innovate out of the problem. So I'm gonna pass the baton to the next person in line.
George Schwartz, tell us a little about what you're working on, which is a little bit of a different approach to healthcare, but it's going to feed into the whole story when we get around the table.
Hi, just by way of background, I worked in a significant family office for the Bass Brothers from Fort Worth and Greenwich for years prior to getting involved in the business in which I currently live, which is the world of molecular diagnostics.